As cases of coronavirus surge in multiple parts of the country, experts are warning that bars may be a hotbed of transmission. ABC's Ariel Reshef has a closer look at how people congregating at crowded bars could be playing into an alarming pattern.
With summer in full swing, more Americans are heading out in search of fun. But with cases of COVID-19 surging in many parts of the country and deaths in at least 33 states and Puerto Rico on the rise, scenes like these of packed bars are stoking alarm and prompting calls for closures from the nation's top experts.
Close the bars. That's where a lot of the transmission takes place.
Stop going to bars and indeed close the bars.
They open up bars now. They're basically saying goodbye to schools for all of the fall.
Some officials, like Governor Bill Lee of Tennessee, where the state is seeing an increase in cases, hospitalizations, and deaths, pushing back.
I've also said we're not going to close the economy back down, and we're not going to. But I appreciate their recommendations, and we take them seriously.
But neighboring Kentucky became the latest state this week to announce it is shutting down bars.
I'm not going to pretend like there are some small businesses that won't make it through this. But I'm dealing with an international health pandemic that threatens the lives and the health of our people, the overall health of our economy. And I've got every public health expert from the White House down to the states saying we absolutely have to do this. Otherwise, we'd have to have more widespread closures.
From the governor of New York, this warning.
You don't socially distance, you don't wear masks, the virus spreads, and it is happening. To young people, this is not the time to fight for your right to party. There is an attitude that young people are immune. You are not. 21 to 30, the virus can kill you.
Authorities in New York cracking down, suspending the liquor licenses of several bars for allegedly violating safety protocol.
They had like a big party without breaking the rule. Breaking all the rules without social distancing, and I think that's a problem.
So just how dangerous is grabbing a drink at a bar with friends? We asked infectious disease specialist Dr. Simone Wilds.
At this time, bars are very dangerous because you have a lot of people gathered together in crowded spaces. They're drinking, they are talking loud, they're sitting close to each other. These are all factors that help with the spread of the coronavirus.
What's your reaction to some of the images that we're seeing of these crowded spaces like bars and restaurants?
It's very scary to me, especially with the number of cases that we're seeing right now in the country. This is not the time to be out celebrating. We have a lot of people that are very sick. Really, we're trying our best to cope and deal with all the stresses from the coronavirus. Being out partying is not one of them.
And the rising cases of COVID-19 in our younger generations is a trend seen across the country. In Arizona, 49% of cases are among people ages 20 to 44, the highest of any age group by 33%. In Minnesota, 42% of cases are among people ages 20 to 39. And in California, more than 60% of cases are among people ages 18 to 49. And many elected officials are pointing the blame at bars.
A night out at the bar is too often leading to nights in the hospital for family, for friends, and for neighbors. By focusing on bar areas, which are proven to be hotbeds for congregation and community spread, we can help keep both Minneapolis and Minnesotans safe and help keep trends stable.
Wild says the more that young people defy the CDC guidelines for mask wearing and social distancing, the worse off we could be come fall. What would your message be to people who have gone out and are continuing to go out to bars?
I would really say at this time, please, we have more than 4 million cases of coronavirus in the country. This is not the time to be out partying. If you really need to go see your friends, you can do outdoor dining, do small groups. We definitely don't want you out celebrating at this time. We have a long way to go. COVID-19 is still with us.
As for the bars that are following the constantly evolving protocol, some say they will do whatever it takes to stay open safely.
It's been very stressful, for sure. Each day has brought something new regulations, new staffing issues, changes in laws, the food issue, things that we need to adapt to. We want to make sure everybody's safe and we're doing the right thing.
Dr. Wild says there are ways to lessen but not eliminate the risks.
Make sure that they have seating capacity at a much lower rate. They also want to make sure that they limit the time people stay in the bars. They're probably going to have reservations. They could get people outdoors, like an outdoor bar would be a great idea. And another thing which might be very helpful would be turning the music down a little, because as the music is loud, people shout and talk at a higher rate. And so that's also another factor that might help with the spreading of the virus.
Bottom line, experts say think twice before bellying up to the bar. Ariel Reshef, ABC News, New York.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.